Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Hey everybody, welcome back to the Namaste Wellness Show, where we talk about all things holistic health for the mind, body, and spirit, for people and pets with a touch of cultural soul. My name is Laura, I'm your host. Thank you so much for being here. Today our topic is going to be issues in mental health, and I actually have two guests with me today. My first guest is Tamara Wright. She's a licensed professional counselor, certified vocational rehab counselor, and a certified brain injury specialist. She has 7 years experience in mental health. She's also the content creator and host of Quickies podcast, which streams on major podcast sites such as iHeartRadio, Spotify, Apple Podcasts, and Podbean. She is a mental health provider for the Boris Lawrence Henson Foundation, providing mental health services for sports communities and their families. And she is also the owner of OCVR Care LLC Therapy Center. She's also served the veteran population for the past 5 years. So welcome, Tammy White.
Hi.
Hi, Tam. How you doing?
I'm great. How are you?
I'm doing good. Okay, Tammy, so go ahead and tell us tell us about your show, Quickies. What is that?
Well, first and foremost, thank you so much for inviting me on today. Quickies is a podcast that I put together to be able to provide about, I always say 10-ish minutes of therapy for people on the go, where they can just tap in and maybe scroll through, find a topic that they like. And they could do that, riding in the car, at home, while they clean up their house, or just, in some of that downtime. And I decided to do that because there's such a stigma and a reluctance on people just reaching out and getting therapy. So I figured, let me just kind of lighten that stigma a little bit and just kind of make it more inviting, something like, oh, okay, I can just reach out. I don't have to go into, right away, go into a therapy office or have so much pressure to try to find a therapist or even admit that I need one in the first place. Correct. So some topics that people can relate to for the most part.
Okay, very good. So you're going to be doing a quickie for us today. So whenever you're ready, you can go ahead and start and tell us what your topic is, etc.
Yeah, sure. What I decided to do today was just touch base actually on 1 to 2 of those topics that I already did. Mm-hmm. There are 2 episodes that I put out there. One of them being named Goodbye, Debbie Downer. And that was actually one of my first ones. Mm-hmm. And the reason for that was to basically touch on topics that people kind of shy away from when they may be in the company of someone who's just extremely negative. Mm-hmm. And they are projecting that negativity onto another person.
Hold on 1 second, Deb. I'm sorry, Tammy. Let me just kind of set it up. First, you're going to describe the Debbie Downer personality, correct? And then you're going to talk about, or tell us, can you kind of set it up for us, how you're going to do it, and then go into it? I didn't mean to interrupt you, but I kind of want to set it up a little bit.
Okay, sure. Okay, so basically, what I'm doing now, I'm just summing up the episode and kind of the reason for it and the basis of what a Debbie Downer is, because a Debbie Downer is not a syndrome or like a mental health disorder or anything like that. Okay. That word, that phrase, and some people may have heard it, some people may have not heard it, that Debbie Downer is just simply a person who always have a negative type of connotation to them when they are talking to someone in their content or context. So that's what that particularly means. So the purpose of me getting onto that was to just kind of go into the background of what can be happening to a person who may be experiencing low self-esteem,
Oh, okay.
or maybe like a body dysmorphic disorder type of a situation, or something where they're looking at themselves as less than, and why that could potentially be happening. So
Okay.
that was kind of the premise for that particular type of an episode. And
Okay.
so what I did in that episode, I touched on, like, okay, some of the scenarios in which this could be happening, to try to shed light and to try to bring an awareness of what that looks like and how that behavior can be toxic, right?
Okay. Mm-hmm.
And from whom that could be coming from sometimes, because sometimes you don't know what's happening to you, and so you may be in that sense of, oh, I'll just laugh it off, or just shrug off a comment that somebody said that I don't particularly like, but then you
Mm-hmm.
go home with that, and then you harvest that, and then
Right.
it hurts, and it
Right.
becomes a deeper wound and a deeper sting, and it's just a negative entity, right?
Okay.
And so that is one. And so in that particular episode, I talked about, what could potentially happen to someone. Let's say, you're in a relationship with, a significant other, spouse, or what have you, and they always make particular comments about you, or
Mm-hmm.
comments about your body, or could comment on your weight, or,
Mm-hmm.
for example, there's one particular segment where I said, maybe your spouse may comment and say, oh, your jeans have been getting too tight lately, or
Hmm.
and the person may shrug that off, but it may sting,
Internalize it. They kind of internalize it.
right, and not say anything. So
Right.
in that episode, I also talk about, okay, assertiveness, because I do a lot of assertiveness training with my clients, where you go from a passive state of being to more of assertive state of being, but you're not aggressive. So you're not, it's somewhere in between.
Mm-hmm.
And learning an assertiveness skill is a very safe skill, and it's a skill that you can use with people to set boundaries,
Right.
with people, to stop people from kind of trickling over those lines that you don't necessarily care for. Um,
Right.
and so in that, I also, in that episode, I also just kind of give some comments, some examples of what you can say to that type of a, comment that's made at you, and so forth.
Okay.
Yeah, so I can give an example of that if you would like for me to give.
Yes. Thank you.
So, yeah, sure. So with that particular statement, your spouse says, okay, I think that your jeans are getting too tight. A typical response would be for somebody to just kind of laugh it off and, oh yeah, wow, you think so? But more of an assertiveness stance on that would be, well, I actually feel good about wearing these jeans. And, if you have something to say about how they look on me, maybe we can discuss that, you
Mhm.
know, but to address it in whichever way that makes that person feel comfortable, to just address it and not let it just roll off. Because when you address it right then and there, you kind of deal with it, you kind of let it go, and you kind of address it there, versus taking it back with you and letting it become a repressed thing that's
Right.
always there.
Right. Okay.
Yeah.
So, yeah. So I mean that's interesting because I wonder how that could tie into, there's a lot of talk now about how young girls are feeling um depressed, and maybe they have some self-image problems. That might be one of the things that you might really work with a young teenage girl on, because they are saying that a lot of teenage girls are having difficulties now, more so than before, not before COVID. They were having a problem. Well, in fact, I do have a study here, which I would also want to run by, and maybe we can go ahead. So, did you want to share any other examples of the Debbie Downer? Actually, do a little segment for us, or did you want to just share a little bit about the therapy that you actually offer? Maybe you want to share some contact information, or how people might be able to contact you directly. And if they have a problem like that, that they can come to you for therapy.
Well, yeah, absolutely, absolutely. There's another episode that I did, and I had a couple of guests on, and that one was titled "I Must Live," and I feel like it was kind of in correlation to the other one, because those type of those type of behaviors coming from someone else onto you
Mhm.
can cause you to go into a deeper depression.
Mhm.
It can go from low self-esteem to depression to, I don't even know if I want to be here anymore type of
Mm.
a thing, right? So that's why these type of behaviors are worth addressing. So yeah, I do work with people with depression, I do work with people with self-image issues and things like that. And I can be found actually on Psychology Today is the best way to find me nowadays.
Okay.
And you could just search OCVR Care, or
Mhm.
search Orchid Core Voc Rehab in Livonia, Michigan. And I can also be found on, there's a foundation if you have some problems paying for mental health or you don't have health insurance.
Mhm.
um, the actress Taraji P. Henson,
Mhm.
sure if you're all familiar, but
Mhm.
she actually started a foundation called the Boris Lawrence Henson Foundation. And
Mhm.
so there are some providers, and such as myself, which is listed on her foundation website,
Mhm.
where you can go on there and you can apply for therapy for free. So that will give you
Oh,
at
okay.
least, yeah. And
Mhm.
that will give you 5 free sessions if you qualify for that. So you just have to go through the qualifications. But again, that is the Boris Lawrence Henson Foundation. And I can also be searched up there at OCVR Care in Farmington Hills, Michigan, on that particular site.
Okay. All right then. Well, tell us a little bit more about how people can watch or listen to your podcast. When
Yeah, the podcast can be caught on iHeartRadio. It can be caught on Spotify. It can also be caught on Podbean and Apple Podcasts. So you just have to go in and search up. It's called Quickies with Tam White.
mm,
And there are episodes there. They usually come out on Sundays, but I hold no, I don't want to hold anybody to any pressure to actually have to go in on Sunday. So you can just kind of go in at your leisure whenever is right for you to listen there. And select different topics there. And you'll find a range of topics from, self care topics to, navigating the dailies of life, to going from assertive going from passive to assertive, all those things, some things that'll help you in different areas, hopefully.
all right. Okay, Tammy. Well, thank you so much for being with us today. And I hope everybody will go and check out there are quickies on all the different podcast sites that you can listen to with Tam White. And feel free to, stay and stay with us for the rest of the show. Now, did you have anything else you want to share with us before I let you go? Because I know you have had a schedule today. So something else scheduled today. Is there anything else you'd like to share?
I don't necessarily think so. Not in full, but maybe in part, real quick. There was something that you said about the young ladies and the young ladies nowadays dealing with, the statistics on
Yeah,
mental health with a certain age group.
yeah.
And
Mainly teenage girls, pretty much.
right.
And
Yeah,
this
maybe.
actually came out from the Surgeon General. This is part of a Surgeon General's report. Yeah, and they're saying it's related to many factors such as social media, climate change, self image. I mean, the gamut just goes in terms of what the causes are. But go ahead. I didn't mean to cut you off.
No, you're
Finish your
perfectly fine.
thought. Uh-huh.
Yeah, I actually agree with all of that, but that is true. NAMI has done some research on that as well, and that's the National Alliance on Mental Health. But they have done some research on that, and there is a lot of that. And I would say definitely, from even some of the research that I have done personally, social media, being on the top of the list.
Mm-hmm.
And the hardest part is getting that particular population to admit that. But what happens there is you have a lot of young ladies who are still going through development at that particular time, finding out who they are, and trying to gather who they are from all these different entities. They're gathering that from family, from friends, from social media, from school, from whatever it is that's around them, television, whatever it is, and then
Right.
they're internalizing that and trying to figure out who they are they good enough, can they fit into a crowd and so forth. And so there is this trend now that's going around for young ladies to cut themselves. And
Mm,
it's very sad, and there's little attention being brought to that. But I wish that there would be more awareness on that, because a lot of the time, depending on how they go about that, they may just be crying out for help, and then that slice can lead to something that is permanent. You know,
right.
so
Yeah.
it's kind of like, that's why I talk about in one of the episodes there, people who are, suicidal or have suicidal ideation are attempting to look for what is it, a permanent solution for a
Mhm.
temporary problem, right?
Mm,
Um,
mm. That's
so that's something worth, just talking about and, bringing attention to. So yeah, I don't know how we're going to do that collectively as a mental health, industry,
yeah.
but it's time to raise awareness on that. So I just wanted to mention that also.
Well, they say it takes a village to raise a child. So, it takes the parents, it takes, professionals like yourself, it takes teachers, it takes everybody. So, hopefully, there can be some progress made in that area. Okay,
Absolutely.
Tia. So, thank you again for being here. And I want to go ahead and introduce you, and you're welcome to stay. With us, Tim. We've got Dr. Howe is coming on with us, but I want to just go ahead and introduce my next guest. Ayanta Howe, MD, is a double board certified child, adolescent, and adult psychiatrist with over 14 years experience working in a variety of clinical settings, including prisons, residential treatment facilities, and partial hospital programs. She obtained her BA from or bachelor's degree from University of Michigan, medical degree from Wayne State University of Medicine, and she went on to complete her child and adolescent psychiatry fellowship training at the University of Pennsylvania's Children's Hospital of Philadelphia. She enjoys working with all age groups and has served ethno-culturally diverse populations, engaging with patients, families, and partnering with team members within complex organizational structures. In addition to interventions such as medication management, Dr. Howe places a strong emphasis on psychoeducation with the goal of empowering patients on topics such as disease recovery and disease prevention. Welcome, Dr. Howe. Dr. Howe. Hi. I think, can we hear you?
There we are. Sorry about that.
Okay, there you go. Okay. All right. So, welcome. Thank you so much for being here. Just briefly tell us a little bit more about your background and what inspired your choice to become a mental health professional or psychiatrist.
Yeah, sure. From a young age, I always knew I wanted to be a doctor. I didn't think it would be psychiatry, but I always knew I wanted to either be a pediatrician or some kind of doctor working with children.
Okay.
So, I do enjoy working with all age groups, but I have kind of a particular affinity for teen girls,
Right.
adolescent
Yeah.
girls,
I know. Yeah.
mainly because my own adolescence was difficult
Mhm.
for similar reasons that Tamara was just speaking about.
Oh, wow.
That's a time in
Okay.
your life where you're trying to figure out who you are.
Right.
Where do I fit in?
Mhm.
Who am I? You're just kind of coming into womanhood. And that was just very difficult for me.
Yeah.
And even in my teen years, I did have depression. I didn't know at the time that that's what I was dealing with, but it would come and go. And it just really affected me to the point where it made me, make a lot of really bad decisions and kind of
Mhm.
hang out with the wrong crowd and things like that. So
Oh.
fast forward to medical school, um,
Mhm.
obviously that was a very stressful, time, a lot of
Yeah.
academic requirements and things like that. So under the pressure of that, I actually developed a full-blown major depressive disorder as well as some anxiety, and had to sit out of medical school and got into therapy, which was amazing.
Okay.
Um, and just, it really opened up my eyes to the world of mental health. Like I said, I'd never considered going into psychiatry ever, ever, ever.
Yeah.
But, even with the therapy, I still couldn't quite get over that hump. So I actually got on an antidepressant medication. I saw a psychiatrist, and that was a game changer. That really helped me to focus and really resolved a lot of the poor sleep, poor, the low energy and the anxiety that I was experiencing because of the depression, and really kind of got me back in the game, so to speak. So I came back to medical school just really inspired to go into the field of mental health. So that's kind of how I went into it. I kind of backed into it, so to speak. So I like to say that psychiatry called me. Never thought I'd do this, but I absolutely love it. So
well, that's pretty awesome because, I've known you for a while, and I did not know your background. So, I mean, this is very inspiring. This should be inspiring to any young woman or young teenager girl that here you went through all of this yourself, pretty much. And now you are a mental health professional, you're a doctor of psychiatry, et cetera, et cetera. So that should really motivate people just because they have, some situation in their life that they may feel down for a time. There may be a calling, right?
yeah,
So you said psychiatry called you. So, right? So
Yeah.
Tim, did you want to weigh in on that? You look like you were thinking of something there. Or did I misread you? Okay. Yeah. You can feel free to,
Yeah. Sometimes it is a field that calls you.
Mhm.
I don't think most people choose this field. Sometimes they do. But I definitely did not, because I was on a totally different path, prior to this. And then it just kind of came upon me and I accepted the call. So,
Yeah.
but I agree with you. That's why I'm nodding. I definitely agree with you, Dr. Howell.
Yeah. And I'm not that you have to share anything, Tam. And I think you said it was okay to say you're my niece and everything.
Yeah,
But
that's fine.
you had a challenging upbringing too,
I
so
did.
right.
Yeah.
I mean, not that you have to, say, but
Mhm.
that just goes to show no matter what your background is, you can overcome anything if you have the right mindset, if you have, hopefully you have the right support system. And if you don't have a family support system, there are professional systems now in place, that can help young people, whether, young boys, young girls, etc., to have some support and see that they can thrive and they can achieve whatever they want to, and not feel that that all is lost. So yeah, thank you, for sharing that. Like I didn't know the background. So what is, Dr. Howell, what is the clinical definition of mental illness? Because
Yeah, yeah, that is a broad term, and depending on where you look, you may get a different definition. But really, mental illness is really a health condition. A lot of people don't know it's actually a health condition.
with
Um,
the brain, so to speak.
Absolutely, the organ of the brain itself, correct. So it's a mental health condition that involves changes in emotions, thinkings, or behaviors that can interfere with a person's social or emotional or even occupational functioning. Put another way, it's just, mental illness is when your symptoms of either depression, anxiety interfere with your ability to carry out your daily responsibilities, whether that's go to school, do your work, focus, go to work, look
Mhm.
for a job, those types of things. So that's typically when we would classify something as a mental illness. So mental illness can occur either inside the body or even outside of the body. And what I mean by that is inside of the body means just like you can inherit things like high blood pressure,
Mhm.
diabetes, those same genes can make a person susceptible to inheriting, let's say, depression, anxiety, bipolar, because it runs in their family. So we see that quite a bit. Now, in terms of outside of the body, what I mean by that is environmental
Oh,
stressors, traumas, things like that, right? So there
yeah.
have been tons of studies that have found that, just having a traumatic experience, such as being sexually assaulted, actually changes the brain chemistry so
Mm.
that you actually have lower amounts of serotonin,
Oh,
yeah,
okay.
lower amounts of dopamine, things like that. So that in and of itself, the trauma of that psychological situation will actually change the brain chemistry. So we've seen that. Head injury can certainly affect different areas of the brain that can show up and look like a mental illness. So there's so many things, like I said, both inside and outside of the body that can cause those things.
Okay, that makes sense. So, okay, and then also define exactly, because I'm, as I talk to different mental health professionals, they say this mental health professional does this one does that. There's so many different approaches and how its services are provided. What do you do as a psychiatrist?
Right. So psychiatrists are actually medical doctors. So, I went through 4 years of medical school, just like an internist or a surgeon or OBGYN would go through. So I basically learned how the body or the organs inside of the body can affect a person's psyche and vice versa. For instance, I remember when I was in training, part of my psychiatry residency included rotating through like the mental health department or like the emergency department. So we would have people come in to the ER complaining of suicidal thoughts. Maybe they had gotten into a fight, they were irate, they were psychotic, they were saying that they were hearing voices, those types of things. So my job was to go down and assess that patient and to determine if either A, they needed to be, admitted to a psychiatric unit, or if they were stable enough to go home, or maybe if they needed kind of a partial hospital situation, meaning that they would attend a group and see a psychiatrist during the day and then go home at night. So before I made that determination, I would have to look at their lab work to just make sure there was nothing, medically going on. Say, for instance, their blood sugars were through the roof or their blood pressures were super duper high. I would then tell the emergency department team, please stabilize this patient first, and then I will come back and assess them. Because a lot of times high blood sugars, low blood sugars, high blood pressures could potentially indicate a stroke or, so you have to kind of tease out, well, is this a truly psychiatric issue, or is there something medically going wrong in another organ system that could be causing these symptoms, or is it both? So it takes a team of, doctors, nurses, case managers, social workers to really help to meet this patient where they are. So that's pretty much what I do. I tell people, before you tell a person they're depressed or anxious and they need to do this or that, send them to their primary care doctor. That way they can get, the necessary workup to really see what's actually going on, because there's tons of mimickers of mental illness. For instance, certain medical issues can look like depression or anxiety. For instance, if a person has low vitamin D, that can cause depression, anxiety. Anemia can cause panic attacks. Thyroid illness can definitely affect a person's mood. Withdrawing from certain substances or using certain substances, being intoxicated from certain substances can look like a manic episode. There's so many different things. Heart issues can precipitate anxiety. So really starting with a primary care doctor, everyone should have a primary care doctor. And that's what I tell my patients, because you really have to prioritize your physical health because it's directly tied to your mental health.
I like that. Absolutely. That makes sense. Okay, so anxiety and depression may not necessarily be considered mental illness, correct? Then, based on what you're saying, they could be related to vitamin D, low vitamin D, or
right. Well, you have to look at the symptoms. Symptoms are not a diagnosis; they're symptoms. So symptoms can clue you in as to what may be going on. So a doctor, would determine those types of things. Is it this or is it that? So if I feel anxious, it doesn't mean I have an anxiety disorder. I could have low blood sugar. I could have low red blood cell count, right? Or I could have just been robbed, 10 days ago.
Right.
So really asking these questions and really probing, what's going on. So you really need more information before you actually diagnose an actual disorder, a mental health disorder.
Okay. So a mood disorder is, how would you describe a mood disorder then?
Right. So mood disorders have been they kind of have their own classification. And that's because years ago, that's just how mental health professionals decided to classify them. So in general, moods are generally described as being either positive or negative. And that's what Tamara was talking about a few minutes ago when she talked about Debbie Downer and things like that. So moods are kind of a description of our general disposition throughout the day. Are we up, motivated? Are we down, depressed, low energy, that kind of a thing?
So that's why they use they have these, charts where you say, are you smiling? Are you frowning? Okay.
Emojicons, absolutely.
Yeah, okay.
Yep. So it's basically the highs and lows of a person's emotion. So the term mood disorder is a mental health classification used to broadly describe disorders that can cause extremes in a person's mood. So this would include things like bipolar disorder, major depressive disorder, seasonal affective disorder, even disorders that are due to like a drug such as alcohol, cocaine. These are examples of a mood disorder, as opposed to maybe something like anxiety, schizophrenia, ADHD. Those fall outside of the classification of a mood disorder. So when you think mood disorder, think extreme elevations in mood or extremely low moods.
Okay.
Yeah, so those are mood disorders.
But in any or all of these cases, because I know you do advocate, a lot of people nowadays, they want to do either prevention, and I know, tell us a little bit about, because I know you do work with prevention. So before you would actually prescribe a psychotropic medication, what type of preventative measures would you recommend, or have you already went over them when you said, have a primary care doctor, take care of yourself, blah blah blah, or so on?
Right. So most patients, when they come to me, the house is on fire, so to speak. By the time a patient sees me, probably something really bad has happened. Okay. Number one, there are not a lot of psychiatrists. So a lot of people either are on these long wait lists to see a psychiatrist, or they wait until things are just out of control. Either therapy didn't work, or they never tried therapy or meds. They just let it kind of play out. And then here they are. So I never really get the luxury of talking to them about preventative measures. Now, primary care doctors are trained to do that. And the hope is that they are doing that, assuming that the patient actually shows up to see them. So I don't always get the chance to talk a lot about preventative measures because, number one, a patient is far beyond preventing the illness, or number two, the patient has a mental health disorder that no matter if they did do things to try to prevent it, they would still have that disorder. And that's particularly in cases of extreme trauma, extreme losses, or if there's a genetic predisposition, meaning this person was just kind of genetically set up to get a disorder. However, say for instance, I did have a patient who was completely symptom-free. They had no mental illnesses, things like that. What I would probably tell that patient is, very, very simple things to do, which, they may sound simple, but they're not always simple. But number one is getting sleep, right? Getting enough sleep, setting aside enough time to sleep. That in and of itself can prevent tons of mental health issues and even mental health symptoms. Things like anxiety, irritability, those types of things. If you're getting enough sleep, you're going to just overall in general be in a better mood. So the National Sleep Foundation has made recommendations on the total number of sleep hours based on a person's age. And in particular, since we were talking about teens, so teens and adolescents really should be getting anywhere between 9 to 11 hours of sleep at night. Wow. Now, as Tammy was talking about social media, kids, for whatever reason, parents of children either are reluctant to or don't know that their children are up at night, all night on their phones or on the computers, right?
Well, Sam knows that. She has has. Yeah. Okay. I'm sorry. Go ahead.
Oh, no, it's fine. So yeah, I talked to a lot of parents about, providing structure around access to electronic devices, because it is the number one contributor to poor sleep, which can either precipitate a mental illness or worsen it. So that's number one key. Again, something that sounds very easy to do, but not always.
Can I ask a question? Does that have something to do with the levels of brain? I might be when you're sleeping, your brain is in a certain level of repair or something like that, or does it have anything to do with that? Since mental illness is considered a brain condition. So
right.
Go ahead.
I didn't want to cut you off. Were you going to say something else?
No, go ahead.
Okay. Yeah. So sleep actually solidifies a lot of the information and materials that we take in throughout the day. It processes, helps to make sense of what happened. These are the things of dreams. And even in REM sleep, that really helps, especially students, teenagers, things like that, to kind of solidify the information that they learned during the day, say, for instance, in school. But you really have to spend enough time in sleep in order to get into that deep REM sleep. So if you're not sleeping properly throughout the night, if you have a lot of breaks in your sleep, or if you're not, again, devoting enough time to sleep, you're going to have problems learning. You're going to have problems just, paying attention and relating to other people. I mean, we know that when we're not rested, we're irritable, we're short with people, and it just overall decreases our quality of life. And a lot of studies have even found that poor sleep can lead to things like heart attacks, obesity, high blood pressure. So sleep is extremely important across all domains.
Right.
Right.
So that should be the number one tip. And it's I say it's simple. It's not simple to get somebody who's used to staying up. And, I've struggled with that at times myself, being so busy, but to say something as basic as sleeping can help us with so many areas of our lives that, how can we get people how can we get our teenagers to sleep more, so I don't know, Tam, did you want to weigh in on that a little bit, or?
Well, yeah.
I'm sorry, let me cut you off real quick. I wanted to ask, would you recommend, Dr. Howe, that before someone comes to you, when when the fire is already blazing, would you recommend, and Tam answer too, that they would probably go to someone like Tammy first to work on those things as more of a preventative approach to prevent having to be on fire and see a psychiatrist?
Yes, for sure. And I would like to, give the floor to Tammy. I would absolutely recommend that. Yeah.
Yeah. I think that I agree with the flow of that. Sometimes though, believe it or not, sometimes I'll even get some people that have waited quite too long to see someone as well. So then I'll go and I'll collaborate with a psychiatrist. And then we'll do both of those things. So where I may be on one end teaching the coping skills and stuff like that, then they're also trying out whatever, either holistic approaches or medications that has been recommended by the psychiatrist, depending on what that person is, offering at that time. But in regards to the teenagers and in regards to, that population and Dr. Howe's totally right. You don't know. It's very hard for a parent to monitor what's going on when you're not there, and you turn off the lights and you say, oh, everybody go to sleep, and it's like, what? Yeah, right. But you leave them with that device. And so, it's hard. It takes a commitment and consistency, but to just simply remove the device,
Right. Yeah.
If there's a plug, if you say lights out at 9:00, remove the plug. We have to go back to thinking in that way, because if you don't, we can't trust. They're not even developmentally on that level yet to be that disciplined, to be able to just say, okay, I'm not going to engage in this because my parents told me not to, or my caregiver told me not to. They'll do it anyway. Right. So that's just one of the suggestions that I have, like with some of the adolescents that I see. And then I kind of just touch base with the parent and just ask, if they can kind of work with me on those type of things. But a lot of times I get to a point where my teens, at least they're telling me that they're limiting their social media. I don't know if they are or not.
But aren't there parental controls too? And if the parent is paying for the service, then, so it seems to me that a lot of the help can actually come from the parent and therapist relationship, and the child seeing that the parent and the therapist are in one accord, so that they see that stability and that they know, even though they might not like it, right, but still it's ultimately for their better good. So Yeah.
I would definitely agree with that. One rule of thumb that I have when I have a kid who comes in and the parent complains of, this child is just always on their phone or social media, my first question is usually, okay, mom and dad, how much time are you spending on social media?
Mm.
Because unless proven otherwise, a child who has poor parameters around social media use usually reflects a parent who does. So a lot of times parents, because they are either overwhelmed or, stressed out because of their jobs or busy schedules, they tend to quote unquote self-medicate by being on their phones, right? So how can I really tell my kid, you can't be on your phone if I'm always on my phone, let alone do I even know what my kid is doing because I'm in my room doing my own thing, right? So
Right.
parents are very stressed. Even the statistic that you quoted before with the Surgeon General stating that a lot of our teenagers, especially teen girls, are struggling with mental health issues
Hopelessness,
at unprecedented rates. I
Mhm.
think that reflects parents who are struggling with mental health issues from unparenthood because these children are not being raised in a vacuum, right?
Right.
So usually, and again, unless until proven otherwise, if I have a teenage girl who comes into my office and she's struggling with anxiety and depression, I
Mhm.
want to talk to that parent about how they are navigating if they have anxiety, depression, how are they navigating that for themselves? Because children, they pick up on these things, right?
Mhm.
Um, I think that a lot of parents don't realize that they really set the tone for the emotional atmosphere of that child's world. And they
Mhm.
really provide a template of what it means to recognize, understand, and really develop a vocabulary necessary to process difficult emotions. So, say, for instance, you have a father or a mother who, when they're stressed, they isolate in their room. So, what are
Mhm.
you teaching your child, right? So, isolation we know leads to loneliness, which is a huge risk factor for things like depression. So again, I want to know what is going on in that home, not to criticize or blame, but to get help. Because if that parent is not getting help for their issues, then
Mhm.
that child, there's no, reason to wonder why that child is struggling. Right. So I think a lot of that attributes to um, the high rates of mental illness that we see in our youth. I really do. I think that their parents are not seeking the help and the kids are just following suit, right? And
Right.
then you add that into the genetic predisposition that I spoke about before. Mom, dad, grandma had depression, anxiety.
Mhm.
So I'm more likely to have it. But if no one's getting treatment, then I'm not going to get treatment. I'm just going to, use the influences of my friends, social media,
Right.
to
Mhm.
see how they're dealing with it, which a lot of it has to do with, alcohol, drugs, marijuana is now legal in many states. Now
Mhm.
it's not legal unless you're 18, which I often have to tell my teenagers because that's one of the main things that they
Right.
say. Dr. Howell, well, marijuana is legal. I said, it's not legal for you because
Right.
you're 18, number one, and number two,
Right.
this is going to cause a number of other issues. So,
Right.
these are just some of the things that I think about when
Right.
I treat some of the people that come into my office.
Right. That is so key. I mean, it's if the parents really have so much influence on their children, they really don't realize it. But if the parent is not able to be present with them, then they are going to be following, their peers, social media, what's happening in school that may not necessarily be in the best interests of the child. So I totally agree. And I hope that people will reach out and see that the child may need therapy, but so may the parent also need help too. And so to make it like a family um, event to seek out for therapy and support. So let's talk a little bit about, we're actually kind of almost running out of time. And I would love to have both of you on again to really further this conversation, which I think really needs to be talked about. But I do want to touch on the psychotropic meds, Dr. Howell, because a lot of people who are now saying they don't want to take the meds, more people are looking at holistic ways to address mental illness. I personally try to do everything preventative and I want to be more holistic and all that, but I do respect that sometimes you have to take the meds. So tell us your take on the major benefits of psychotropic meds, and if there are contraindications, how do you address any contraindications?
Right. So psychotropic medications or psychiatric medications or any drug that affects the chemical makeup of the brain and the central nervous system with the end goal of altering that person's emotion. So psychotropic medications, I think people limit that definition to things that a doctor can prescribe or something you can get from over the counter. But psychotropic medications are things like alcohol, marijuana, cocaine, opioids. I look at those as psychotropic medications because they alter brain chemistry and they affect your mood. So a lot of patients who may say, you know what, I'm afraid of side effects of a medication to help me with anxiety or depression, but they're smoking marijuana every day or they're drinking alcohol to, manage their anxiety. I kind of wonder what really is going on. You know what I mean? Now, the thing
Now,
about,
they are saying, but they do say there are some benefits to marijuana. What do you say?
I get that too all the time.
I don't smoke, I don't use it, but
Okay.
they say, I don't know.
Yeah. So there's a lot of data, and that's a whole nother subject, but there's a lot of data that heralds benefits of the CBD, the cannabinoid element of marijuana. If
Without
you isolate that,
the TCH, without the TCH, right?
correct, without the TCH, without the actual the addictive kind of psychedelic effects of the marijuana, absolutely. The CBD has shown benefits in terms of how that particular component can help with things like pain and moods and sleep and things like that. Although there's not a lot of studies that have consistently backed those up, because the problem is that a lot of people who sell CBD, they aren't necessarily licensed by the FDA. So you don't really know what you're getting. Like they may list what's in the ingredients, but there's no way to regulate that or even know if that's what's in there. So that's the problem with that. But in terms of actually smoking marijuana, I tell my patients, yes, it is going to calm you down. Yes, it is going to take away a lot of the anxiety, but the effects of that are very limited. Like you remain high for maybe 15, 20, 30 minutes, maybe an hour, but then you're going to have to hit it again. So basically you're at home, you're in a situation where you have anxiety, which isn't going away because you have an actual disorder. It's not going away without treatment. So you're basically in a situation where you have to smoke marijuana literally all day, every day. That in turn affects your motivation, your level of motivation to get up and do things. You're not going to want to do that. So how are you going to get up and work? You're spending all this money on it. You are basically high. So how are you taking care of your responsibilities? God forbid you have children and you're trying to drive. We've all been behind a car on the road and, we get a high because the person in front of us is smoking, right? So it really creates a lot of problems and issues. There's still carcinogens in marijuana, just like in tobacco when you smoke it. And a lot of jobs will ding you if you're UDS, if your urine drug screen is positive for marijuana, even if it is legal, even if you are of age. So there's more problems than there are solutions with marijuana. I could go on and on about that because
you get that all the time. Okay.
Marijuana is safe. It's natural.
So, well, then tell us about the positive side of taking psychotropic meds.
So my whole point is there's no medication on this earth that is not without side effects. Whether it's an herb, whether it's something your doctor prescribes you, you're going to have some side effects. You may not have all of them, but you're going to have some. And really talking to your primary care doctor or your psychiatrist about those particular side effects can really be helpful. One really quick thing I want to say is one recent statistic that I found is that 1 in 4 Americans take a psychiatric medication. And a lot of people are concerned, is it going to make you a zombie? You don't see a lot of zombies running around here, right?
Yeah,
A ton of people are.
That's
so the medications in times past were very much sedating, but the ones they have now have a lot of more tolerable side effects.
Okay, so let's because we're actually running out of time. I got to get you ladies back on the show again because this can go on and on. But real quick, Dr. Howe, please, what is your contact information? So if someone wants to reach out to you,
They can email me at my first and last name, no spaces, at gmail.com, or they can contact me on Facebook under my name.
Ayanta Howell. That's IYANTTAHOWELL on Facebook
Or my first and last name at gmail.com.
first
You can
and
email
last
me.
name at Gmail. All right. Thank you, ladies. This has been an awesome conversation. Want to have you on again. Thank you all for watching. Please join me next Wednesday at 11 or every Wednesday at 11 for the live show, or you can see all the replays on all your major podcast sites. Thank you for being here. Until next time, stay safe, stay well. Namaste.